Hi, we're back. So we are back from X-ray. So this patient's central line is patent and okay. I'm still wearing my sterile gloves, but we're being a little bit more basically aseptic at this point, and we're going to be putting a wrap on this neck. Now, one thing to note is the insertion site in this particular model is a little exposed, but it's a good example to show you that sometimes that's going to happen, especially if the animal's neck moves. Some of these short-necked animal pets and some of our patients, they're just awkward in their anatomy, and they may be perfectly aligned when they're laying lateral, but then when they move, it might actually shift and move your catheter. So you could be aware of that when you're suturing this in place, and try to find an angle that works in their natural anatomy. That said, we're going to protect this little bit of an insertion site. They're just not, there's no dressing in particular. We're not going to put anything on that. This is just a sterile gauze that I had from my central line pack. And I'm going to just use regular bandage material. So we'll start with, I'll get our bandage material, I'll cast padding. You will likely need an assistant to help you lift the head while you're doing this. And depending on where the central line is placed, if the central line is placed more in the center, you're going to be layering this in and out, so to speak. But in this case, it's really cranial to the patient. It's up here. So you actually don't really have to do too much, but I'm going to show you one thing I will do is I'll tuck these out this way. See that? So now this is secured and protected. So my next layer is going to be the cling, similar fashion. Remember, this isn't going to be tight. This is just going to be a protective covering. And then lastly, your vet wrap, which we always want to stretch out before we roll onto a patient. Okay. So it's always a little tricky when you do this without an assistant because you don't always see what you're doing on the other side. So it's always helpful to have somebody showing you that you're missing a little gap there. I like to tape these down with white tape that I just seem to have misplaced. There we go. Just don't like to have them flopping around. You worry about potentially getting caught on grates, so keep those things in mind when you're housing your patient. But what I often do is just make a little wing and just tape it on to the patient like this. This is usually when I take my gloves off, because the tape does not want to behave. Okay, and then I'll take another piece. And now the central line is secure and placed. If you are doing anything like a hep lock, or you're saving one of these for TPN or anything of that nature, I highly recommend that you tuck these inside and cap them. So what I would do is I would cap this, and you obviously are handling that port 100% sterilely if that's the case. Often we'll label this very loudly, do not flush, and then I'm tucking it inside the patient's bandage so that it's not easily accessible. I mean, to the point where you can hide everything, honestly, because you shouldn't have to use it or flush it anyway. And then when it is needed, then you would wear sterile gloves and handle it sterilely and remove the flush, the hep lock, I should say, from that patient before you use that line. That should be it for replacing the catheters and wrapping them. I can show you in another video how we will remove this catheter.